Hey, this is Anthony Davis with Health or Hoax, and in today's episode we are going to look at an article, which is a review article, on the social determinants of health. So what those are essentially how public health affects your health. So that's going to be things like education, socioeconomic status, where do you live, what sort of healthcare, doctors do you or do you not have access to? Things like grocery stores, things like gyms, things like community gardens, things that can give you an advantage in life. And if you don't have them, does that affect your health? So that is the main subject here. There is a little bit, a few comments throughout this of how race may also predispose you to certain disadvantages, but this is not a paper explicitly talking about the possible disadvantages related to being a person of color. This is an article specifically looking at being lower income. So what we find is that of all of the possible risk factors of basically having bad health outcomes, we find that socioeconomic status is one of the single largest predictors of your overall health. In other words, if we're trying to predict if a person is going to have all these, diseases, these bad diseases, and then if they do get those diseases, are they going to get better or not get better? Well, the way that we would predict that, the best bet that we would have is to see if they are poor or not. And there are a lot of reasons, so we're going to explain that. I encourage you to read this article. It's great, but I've highlighted some important takeaways. So we are going to find, again, that socioeconomic status has been identified as a fundamental cause of disease. And in this group, we're going to see a lot of factors that explain why that is. So for example, they might have poor nutrition, they might have a lack of exercise, they might be more likely to smoke than higher income individuals, and all of these things will predispose them to higher rates of mortality and exposure to certain diseases. So part of that is going to be that they might have a lack of access. So if you are a lower income individual, you might have lack of access to gyms, social support systems, education, good high quality education that would teach you how to take care of your body in the first place. You might have lack of access to good food. There might be a food desert. And you might, even if you have access to good education, you might be working 3 jobs and you don't have time to be cooking for yourself in a healthy way. You might not have time to be going to the gym on a regular basis. So a lot of the preventative health strategies wouldn't even be feasible for you. So there are a lot of reasons here why being lower income sort of traps you in this perpetually bad health sort of situation. And on top of that, on top of having lack of access, you might find that lower income neighborhoods might have overcrowding, poor sanitation, and those factors, of course, also make the spread of disease more likely. Like, for example, right now, we are experiencing a pandemic from the coronavirus, and the biggest thing that we can do is to socially distance, to just keep our distance so we're less likely to infect other people. And the closer you are to other people, if you're sort of packed in like sardines, then you are much more likely to get sick from something that your neighbor has. This would be obviously very sadly, this would be especially true in prisons. Sorry, I just watched some videos from some prisoners taking video. They had some contraband cell phones, and they were taking some videos so that they could expose the conditions of these prisons. And here we are in the middle of a pandemic, and they're basically it's like they have 2 prisoners per cell, and these are basically broom closets. They're sleeping basically right on top of each other, and it's disgusting that we can't that we're not prepared to handle that. But that is a totally different issue. So let's move on here. So the social conditions are described as what is a distal factor. So it's interesting. So having a lower socioeconomic status is a risk of having other risks. So when we talk about diseases, we talk about like cardiovascular disease. We would describe your risks as being like you're more at risk of having cardiovascular disease if you have a family history of it, or if you have high cholesterol, or you have hypertension, or you're a male, or you're over a certain age, or all these other factors, right? So those make you more likely to have a disease. Well, being a lower income individual makes you more likely to have all of those risk factors in the first place, right? So it puts you at risk of being at risk of having all these awful diseases. So if we tackle the income first, then we reduce all of these other risks simultaneously, which is important. Now, socioeconomic status, again, another reason why this is important is because having lower income means that you're going to have less flexible resources. So you're not going to have, for example, savings, disposable income to handle a crisis if you need to. You might not have the knowledge on how to take care of a certain condition or prevent a certain condition. You might not have prestige and power and influence and benefit, social connections that might help to set you up for future success. So those are all things that especially much higher income individuals will have. Now, they break it down into 4 main reasons why socioeconomic status is a fundamental cause. Essentially, these are that socioeconomic status influences many of the disease outcomes. If you get sick, you're more likely to have bad outcomes. If you are lower income, then you're going to have risk factors, as I just described above. You will have fewer resources and education and money and disposable income and people and connections and things like that, which can help you to not only treat disease if you have it, but prevent disease in the first place. And we see that over time, socioeconomic status, even as we make improvements in public health, et cetera, that socioeconomic status still remains as a primary predictor of health. So it seems to operate somewhat independently of other factors. Now, lower income seems to be reflected in poverty, minority status, and low education levels, and is consistently related to higher occurrence of a range of major diseases like cancer, heart disease, stroke, diabetes, etc. So there's an overlap here between, I just want to point this out, specifically how race plays into health outcomes would be a topic of another video, but I do want to just point out that there is definitely an overlap between being low income and being a person of color and having certain health disparities. It is entirely likely, and in the research that I've read, it seems absolutely true that minorities might have unique and different disadvantages compared to people who are lower income. So, and I would just point out too that sometimes in the discussion about race and disadvantage, sometimes people who are poor and white will point out that, well, I'm poor and I have all these disadvantages, so don't pretend like white people can't have disadvantage as well. And of course that's true. Of course, anybody who is lower income, doesn't matter your race, your creed, your color, anything like that. Anybody who's lower income is likely to suffer from disadvantages. We can see in other papers, however, that people of color suffer unique and different types of disadvantage, and they may overlap a great deal with lower income related disadvantages. But it is important to realize that even though they overlap, there are unique differences that individual groups of people suffer in ways that other groups of people do not. So again, we see behavior and lifestyle choices, smoking, lack of exercise, poor diet, obesity, etc. Those are all things that are more likely to be the case for you if you are lower income. And those are going to lead to bad health outcomes. In addition to that, we see more chronic stress, more social isolation, and a lack of preventative care. Now, a lot of these things are not, as I pointed out earlier, a lot of these things are not your choice. You don't have the resources or the time necessarily to exercise or cook right, or you might live in a food desert and you can't even get healthy food if you wanted to. So those are all problems. Now, let's see here. This is interesting. If we see, what we see is that in diseases that we know a lot about the disease and we know how to prevent it, or if people get it, we know how to treat it. What we see is that if it's preventable and we know a lot about it, then people who are lower income suffer a lot more than people who have a higher income. However, what we see is that if we have, and let's see, is it on this page or the next page? Well, what we see is that here we go, for causes that are not very preventable. Essentially, if something is not very preventable and we don't know a lot about the disease, we don't know how to treat it, we don't know how to prevent it, then the disparity between lower and higher income individuals is, that gap is less, significantly less. So what that points to me is that this is largely an issue of resources, and if we can target our solutions towards providing resources, better schools, better education, better outreach programs, better community programs, better hospitals, better doctors. For example, lower income communities are more likely to have doctors who have much less experience in general. So they're going to receive poorer outcomes just because of that. That's just one of many factors. So if we can sort of level the playing field in terms of resources, then we can help to really close the gap here and provide high quality healthcare and preventative care towards lower income individuals. And we see that as we find new treatments for diseases that we formerly didn't know much about, and we begin to implement those treatments, again, higher income individuals benefit from those treatments much sooner than lower income individuals as well. So for example, right now we've got this coronavirus going around. If we were to come up with a vaccine, which I'm not going to talk about whether or not that's likely because I don't know, that's not my field of expertise, but let's just say we came up with a vaccine that worked perfectly, and just hypothetically. Well, we would expect that higher income individuals would probably get access to that vaccine before lower income individuals did. And so they would get treated faster than lower income individuals. So having a lower income just kind of really screws you over in all these different ways. And that's really unfortunate. But it's preventable. We can see that we have the ability to fix it, but we are just not mobilizing those resources. And then lastly, this is the last point of the article here, is they do bring up again that overlap of lower income disadvantage and then also disadvantage due to race. And so what is said here is that they're proposing that a lack of resources and power, discrimination, and then also violation of human rights are the primary pathogenic forces in creating health disparities for racial and ethnic minorities. So if that, according to that explanation, then discrimination against racial and ethnic minorities is at the root of their their low social and economic status. So in other words, if there is a sort of systemic bias towards disadvantaging people of color into having more lower income, less power, less access to resources, if there's a racial bias that sort of is more likely to put people of color in that lower income place, then they are going to then suffer all of the disadvantages we just discussed. But because race might play a role in making them more likely to be lower income in the first place, then on top of the lower income inequalities, they suffer additional and different types of disadvantage as well. And then the last point here is the question has been raised whether racial discrimination in and of itself could explain poor health outcomes. They point to an upcoming column, which I have not read, which is going to address that specific issue. And I think this is an important point to consider because there seems to be, I've been watching a lot of debates about this, about healthcare and racial inequality. And it seems very strange to me that a lot of, really a lot of white people are saying that, well, race doesn't matter, it's just about being poor, so we need to attack classism in our solution. And of course that's true. Of course we need to address classism, but it seems like this question of, well, does race alone provide additional discrimination? And at least from what I've read so far, it seems absolutely yes, it does. But that is not the subject of this video. So I want to find research. I don't like to just give you opinions on this channel. This is about research. So I will find it and I will present it in another video, and I hope that you'll watch. Hey, this is a really touchy subject, this, especially as soon as we start talking about race and healthcare and race and disadvantage, etc., but also about lower income disadvantages, etc., that we don't usually consider when we talk about healthcare, which is really unfortunate. So if you have comments, insights, if you think I said anything that's not quite right, I really, really would like for you to comment and tell me why, or expand, or share your own thoughts, or share your own experience. This is a place where discussion is encouraged. So thank you for watching, and I hope that you'll join me on the next episode of Health or Hoax.